Hello everybody, this is Dr. Kukreja Kalani. I am a homeopath practicing since last 25 years. Today I'll be speaking in detail about gastrointestinal diseases in children and adults. So gastrointestinal diseases encompass a variety of disorders that affect the digestive system. Here's a summary of the causes, symptoms, risk factors, general care and dietary restrictions for specific GI ailments. The common gastrointestinal diseases are, first we'll start with GERD, which is a Gastroesophageal Reflux Disease. The causative factor is the weak lower esophageal sphincter, that is a LES. Next is obesity, hiatal hernia, eating diet which is rich in spicy, fatty foods. Symptoms are heartburn, chest discomfort, sour taste in the mouth, difficulty swallowing. Risk factors are obesity, smoking, pregnancy, a diet which is faulty, prolonged use of certain medications such as NSAIDs, and the restrictions are avoid acidic foods, especially like tomatoes, citrus, and reduce the consumption of spicy foods, fatty meals, chocolate and caffeine. Next we come to the IBS, which is the Irritable Bowel Syndrome. The exact causation is unknown. Factors include gut-brain interactions, stress, abnormal GI motility. Symptoms are abdominal pain, bloating, cramping, constipation, diarrhea, changes in bowel habits. Next we come to the celiac diseases. The causes, it's basically an autoimmune response triggered by gluten, a protein in wheat, barley. It's also could be because of the genetic predisposition. The symptoms are diarrhea, bloating, fatigue, weight loss, abdominal pain, irritability in children. So restrictions can be a strict avoidance of gluten-containing foods, careful label reading, use of gluten-free substitutes. We describe IBD, that is the inflammatory bowel diseases, or say that's a Crohn's disease and ulcerative colitis. And it's an immune system dysfunction. It can also be because of genetic predisposition and environmental factors such as infection and stress. The symptoms include chronic diarrhea, abdominal pain, blood in stool, fatigue, weight loss, malnutrition. So risk factors include a family history, next is smoking and other environmental triggers. So dietary restrictions include avoid high during the flare-ups, avoid spicy food, caffeine, alcohol and dairy if you are lactose intolerant. Next we describe the peptic ulcer disease. The causes could be the H. pylori infection, long-term use of NSAIDs, excessive alcohol consumption and smoking. Symptoms include burning, stomach pain, bloating, feeling full quickly, nausea, vomiting, dark or bloody stools. Next is the gastroenteritis. Causes could be viral or bacterial infection. So basically it's because of eating contaminated food or water, poor hygiene, and the symptoms are diarrhea, vomiting, stomach cramps, fever, dehydration and fatigue. Risk factors are close contact in crowded settings, weak immune system, poor sanitation, and it is usually found in young children and elderly. Next we describe the gallstones. So it's basically imbalance in substance that make up bile, that is a cholesterol and bilirubin, incomplete gallbladder emptying. Symptoms are sudden pain in upper right abdomen, back pain, nausea, vomiting pain after eating fatty meals. Risk factors include obesity, pregnancy, high fat diet, rapid weight loss, female, gender that is affected more, and women who are above the age of 40. So, and the restrictions involve to take a low-fat diet, avoid fried foods, processed foods, and high cholesterol foods. What is the general care for complaints related to the gastric system. So first is hydration. Ensure proper fluid intake, especially if symptoms like vomiting or diarrhea are present, to prevent dehydration. You should take small frequent meals. Eating smaller meals throughout the day reduces stress on the digestive system and reduces symptoms such as bloating and discomfort. Avoid triggers. Identify and avoid specific foods that trigger symptoms. Next is fiber intake. So for constipation, you need to increase intake of soluble fiber, example oats, banana, apples, to promote bowel regularity. For diarrhea, reduce high fiber foods, avoid exacerbation of symptoms during the flare-ups. Next is monitor food tolerance. Keep a food diary to track which foods aggravate the symptoms. Eliminate or reduce intake of those foods accordingly. Take adequate rest. And next is the stress management. Stress can worsen symptoms, particularly conditions such as IBS. So you should engage in relaxation techniques, sufficient sleep, and activities to reduce stress level. You should take good amount of probiotics because they restore the healthy gut flora, particularly after episodes of gastroenteritis. Foods such as yogurt can prove beneficial. So specific dietary restrictions for gastrointestinal ailments. For GERD, you should avoid acidic food, caffeine, alcohol, chocolate, fatty and fried foods, and carbonated drinks. For IBS, you should avoid dairy products if you're intolerant to it, and so onions, garlic, wheat you can take in moderation. You can avoid fatty foods and artificial sweeteners. In celiac diseases, you can avoid gluten containing grains such as wheat, barley. You can reduce intake of processed foods. In IBD, Crohn's or ulcerative colitis, avoid high fiber foods during flare-ups. Dairy if you're intolerant. Avoid alcohol, spicy foods and caffeine. If you suffer from peptic ulcer, you have to avoid spicy foods, alcohol, caffeine and high fat meals. So basically, in case you have had gallstones, then you can avoid high fat and fried foods and also processed foods. Understanding the causes, symptoms, risk factors and care strategies for gastrointestinal diseases is essential for managing symptoms and promoting better digestive health. Careful dietary adjustment can significantly reduce discomfort and prevent symptom aggravation. So this is in short about the various gastrointestinal diseases, their causative factors, symptoms, and about the detail about what things to take and what things to avoid so as to avoid the recurrent symptoms. This is Dr. Kukreja A. Kalani signing off. I hope this podcast has been helpful in understanding